Hello everyone, and welcome to this audio podcast. This audio podcast is part of this audio podcast in this series, the Quail N Crux. This audio podcast is part of the Bedlam Labostix. This audio podcast is part of the Ricochet and Ruckus, and this audio podcast is part of the Shitstorm Squadron, and this audio podcast is part of a ZtormLabostix production. Through this audio podcast today, I look at an intro into and as part of an important an important scientific scientific condition and clinical condition, and in looking at Huntington's disease. So to begin with, some intro then. So although the earliest known description of what is now recognized as Huntington's disease sort of dates back to 1842 by dates back to around the 1842 or the late 1800s, and sort of where it had been highlighted by investigators or researchers, Waters. It was not until around 1972 when it was a physician, George Huntington, who actually then published on sort of the accurate characterization of one of the main sort of symptomologies. The symptomology is referred to as chorea, chorea, which is spelled CHOREA, and it was this particular symptomology that brought the basis of Huntington's in around aspects of the in aspects of the clinical condition itself, and so it was where the condition became broadly known as Huntington's chorea. However, a decade later, in around 1983, a breakthrough in the genetic understanding of Huntington's occurred when it linked to chromosome 4, and in around the early noughties, 1993, for example, it was when the gene Huntington's was successfully investigated and was identified as the gene responsible, the main sort of gene responsible for Huntington's. So as part of this intro, a little bit in around some aspects aligned to sort of the baseline, the baseline or basis description, and in this audio podcast series there will be sort of a more delving into aspects aligned to the pathogenesis of Huntington's. So Huntington's is hereditary. Is a hereditary neurodegenerative disorder, and is characterized by motor and cognitive and behavioral and behavioral sort of disturbances. Huntington's is also transmitted in an autosomal dominant manner and is clinically defined involuntary, clinically defined by the involuntary sort of involuntary choreatic movements, movements, and sort of the where there is a sort of mental agility disturbances and progressive, and it can be sort of symptomologies in around in around the progressive sort of dementia. Motor dysfunctions also include both involuntary movements such as chorea and rigidity, and voluntary movements such as dysarthria and dysphagia, which compromise sort of speech and swallowing. Um, Cognitive impairment in Huntington's is also characterized by a sort of a decline in sort of higher sort of central nervous system sort of functionality, including sort of deficits in sort of decision making, memory and learning, and sort of visual spatial processing, which sort of impact the patient's or recipient's ability to sort of function independently. The mental agility manifestations such as anxiety, irritability, aggression, and obsession are sort of noticeable in recipients. That being said, viewers and listeners, it is where the symptomologies in around Huntington's are not equal in amongst all diagnosed Huntington recipients. That being said, despite the sort of hyperkinetic movement, such as the symptomology in around chorea, Huntington's recipients often begin to experience challenges in around general pathophysiology as well. The average age onset is between 35 in around 35 and 40 years, and the disease or duration is around 15 years to 2 decades, due to the main sort of neuron loss and progression, with most common cause of death being pneumonia or suicide. The clinical progression of HD is defined into three distinct or three main stages. The initial pre-symptomatic stage is characterized by the absence of obvious clinical signs, despite the presence of the pathogenic Huntington's gene mutation, and this is followed by the prodromal phase, which is referred to a particular phase in the condition in Huntington's referred to as a prodromal phase, during which minor motor and cognitive and mental agility changes may emerge, although they do not sort of concern the sort of clinical they do not concern or have a sort of generic basis that make up part of the clinical diagnosis. The final manifest age is defined by a clear presence of characteristic symptoms or symptomologies, significantly impacting function, impacting sort of impacting sort of aspects of functional capacity and neurological deficits, coupled with the sort of progressive nature of the disease, sort of underscore the sort of complexity of Huntington's. If the symptoms or symptomologies appear before the age of 2 decades or 20 years, the disease or the condition is actually referred to as juvenile Huntington's disease or juvenile HD or JHD, sorry, and where the first symptoms, or the sort of first symptoms or symptomologies can be in around sort of behavior challenges or disturbances, symptomologies that sort of almost sort of depict epilepsy and ataxia or learning challenges or learning difficulties. Around 75% of JHD cases or recipients are due to parental transmission of the mutant Huntington's gene, and at the genetic level, they may contain more than more than 55 particular amino acid repeats or replications in amongst recipients' DNA. So that draws this audio podcast to a close. This audio podcast as part of the Quail N Crux. This audio podcast as part of the Ricochet and Ruckus. This audio podcast as part of the Shitstorm Squadron. This audio podcast as part of the Bedlam Labostics. And this audio podcast as part of a ZtormLabostix production.